I would like to express our gratitude to our colleagues in the emergency room for what they do every day. The emergency room has seen unprecedented crowding in the last few months related to both COVID and non-COVID care demands. You have taken care of these patients with kindness, compassion, and provided them a great experience. For that, we are truly grateful.
The emergency department at U of M Health is unique in both the spectrum of care we provide to an incredibly diverse patient population and in the level of care that we can offer to those patients, whether it be through our pre-hospital care with Survival Flight or within our emergency critical care center. I think we can offer more than a typical emergency department.
Initially, we are the gateway to the hospital. Most of the admissions from the hospital come through us in the emergency department. We are a very busy, fast-paced environment that deals with things from minor illness and injury to major traumas, very critically ill patients.
A typical day in the emergency department, there is no such thing. We have 56 or so different assignments that we can be placed in every day that we come into work. It could be anywhere between our vertical treatment zone, which is our recliner, kind of our urgent care area, to triage, where we have up to 82 patients in our waiting room, to working in our trauma bays, where you can get a heart attack or a trauma patient, an MBC, to working in our ICU, where you get a post-cardiac arrest patient that has 2 pumps and drips going.
Right now, the greatest challenge is the overwhelming number of patients we're seeing come through the department. We're doing the best we can to see each patient in a timely manner, but some days it's really tough.
In the setting of an evolving global pandemic, innovation is a key value that has been driving a lot of our work in the emergency department as we continue to care for and advocate for all of our patients. The environment and challenges that the emergency department is working within is very different today compared to at the beginning of the pandemic, and continues to require us to be innovative and creative.
The Michigan Medicine value of innovation comes to life in the Emergency Critical Care Center, otherwise known as EC3. Since its opening in 2015, it's allowed us more timely access to critical care for the sickest of patients in the department.
The team in Adult Emergency Services leads a lot of research and other innovations to continually improve the practice of emergency medicine and continue to take our care to the next level. And in addition, on a patient level, we are always advocating for our patients with the goals of advancing their health and connecting them to the care that they need.
The Michigan Medicine values that I see mainly in the emergency department are caring and teamwork. This team that we have in the emergency department is absolutely incredible. We truly are a team. We've become a family, and I know that we're always having each other's backs, and we care for each patient like they're our own family.
I love the people. I get to work with an incredible group of individuals, perhaps too many to name. I think we are, by nature, one of the few departments that gets to interface so heavily with every other aspect of our healthcare system and every other specialty in the hospital. And as a result, I've had so many opportunities to both learn from and to develop meaningful relationships with colleagues across the health system.
The great team that I get to work with when I show up to my shifts is my favorite part of the job. Our work can be rewarding, but also very mentally and physically taxing. There is a real sense of togetherness, especially after everything we've been through on the front line of this pandemic.
My coworkers are absolutely amazing. I just think that we all kind of understand each other. We all go through the same experience together. Traumas. We see some really horrible things here, and the fact that we are able to work together and get through those things together, I just truly think that the teamwork and talents and strengths that come through with my coworkers is amazing.
The greatest rewards of working in the emergency department is the caring and the compassion that I get to provide to each patient and their family members. You're there for them on their worst day of their lives, so you really get to share those moments and really try to enhance such a negative experience.
I think another good reward of working in the emergency department is we often get to have an immediate impact on the patients that we see. And whether that be a life-saving, high acuity procedure in the resuscitation bay, or a calming presence and an expedited workup of perhaps an unusual symptom, I think we really do get to make a difference every day.